When most people are diagnosed with diabetes or prediabetes, their attention immediately turns to two familiar areas: medication and diet. Doctors emphasize the importance of controlling carbohydrate intake, monitoring blood sugar levels, and taking prescribed medications consistently. While these steps are undoubtedly essential, scientists are increasingly discovering that another piece of the puzzle may be hiding in plain sight: nutrient deficiencies. Deep inside the body, insulin works like a key. Its job is to unlock cells and allow glucose to move from the bloodstream into tissues where it can be converted into energy. But like any complex system, insulin cannot do its job alone. It depends on a wide network of vitamins, minerals, and biological processes working together behind the scenes. When certain nutrients are lacking, insulin may become less effective, making blood sugar more difficult to control, even when someone follows medical advice carefully. Among the nutrients attracting growing attention from researchers are vitamin K2, benfotiamine, and vitamin D3. Although each one works differently, all three appear to support important functions related to glucose metabolism, insulin activity, and protection against diabetic complications. Vitamin K2 is often associated with bone health, but researchers have found that its influence extends much further. One of its most interesting roles involves activating a protein called osteocalcin. Once activated, osteocalcin helps communicate with both the pancreas and muscle tissue. In the pancreas, it may support the cells responsible for producing insulin. In muscles, it may improve insulin sensitivity, helping cells absorb glucose more efficiently. At the same time, vitamin K2 helps direct calcium into bones and teeth rather than allowing it to accumulate in blood vessel walls. This is especially important for people with diabetes, who already face an increased risk of cardiovascular disease. Large population studies have suggested that individuals who consume higher amounts of vitamin K2 may have a lower risk of developing type 2 diabetes. Fortunately, this nutrient can be found in foods such as natto, aged cheeses, egg yolks, and certain organ meats, making it possible to obtain through dietary choices. While vitamin K2 may support insulin efficiency, benfotiamine focuses on another major concern: protecting the body from the long-term damage caused by elevated blood sugar. Benfotiamine is a specialized form of vitamin B1 that is absorbed far more effectively than standard thiamine. This allows it to enter tissues where it can help support glucose metabolism and reduce harmful biochemical processes triggered by excess sugar. People with diabetes often lose greater amounts of vitamin B1 through their urine, gradually increasing the risk of deficiency. As thiamine levels decline, glucose may be diverted into pathways that produce harmful compounds known as advanced glycation end products, or AGEs. These substances contribute to inflammation, accelerate aging, and damage nerves, blood vessels, eyes, and kidneys. This is where benfotiamine may offer valuable support. Research has shown that it may help reduce symptoms of diabetic neuropathy, including numbness, tingling, and burning sensations in the feet. It may also help protect delicate blood vessels in the eyes and filtration structures in the kidneys, potentially lowering the risk of long-term complications. The third nutrient, vitamin D3, is often thought of as a vitamin for bones, but its role in metabolic health is becoming increasingly clear. Vitamin D receptors are found throughout the body, including on the beta cells of the pancreas that produce insulin. Adequate vitamin D levels may help these cells function more effectively and protect them from inflammation-related damage. Vitamin D3 may also help address one of the biggest challenges in diabetes management: insulin resistance. Chronic low-grade inflammation can make cells less responsive to insulin, forcing the body to work harder to regulate blood sugar. By helping regulate inflammatory responses, vitamin D3 may improve insulin sensitivity and support healthier glucose metabolism. Numerous studies have found that people with low vitamin D levels are more likely to develop type 2 diabetes and often experience more severe insulin resistance. Interestingly, the greatest benefits of supplementation are usually seen in individuals who are truly deficient, highlighting the importance of testing rather than guessing. Although vitamin K2, benfotiamine, and vitamin D3 each work through different mechanisms, they share a common goal: helping the body manage blood sugar more effectively while protecting tissues from the damage that diabetes can cause over time. None of these nutrients are cures, and none can replace medication, healthy eating, or regular physical activity. However, when deficiencies are present, correcting them may provide the body with the support it needs to function more efficiently. For anyone struggling to improve blood sugar control despite following treatment recommendations, it may be worth looking beyond glucose itself and considering the body's nutritional status. A simple vitamin D blood test, greater attention to vitamin K2-rich foods, or a discussion with a healthcare provider about benfotiamine may reveal opportunities that have been overlooked. Ultimately, successful diabetes management is about much more than lowering blood sugar. It is about creating the conditions that allow the body's natural metabolic systems to perform at their best. Sometimes, the missing piece is not another medication, but ensuring that the body has the nutrients it needs to make every other strategy work more effectively.